Um, this is 2 weeks after my surgery. In common words, post-op. Um, Basically, excuse my acne. I have horrible acne. Um, ta-da! I just took my sterile bandages off. They look a lot redder in this light, with the whole glare and everything. Um, yeah, that. This is just to show what's my friends right now, but to get into more detailed technical stuff, for those interested. Basically, this is 2 weeks after my surgery. I had to have a binder on the first entire week, which was like that, with the blood grenades, as my friends called them. I had that on for a good week, with the drainage. Just basically, whenever they had this incision, there was drainage from that, and so there were two sites at the end here where I had drains coming out, which caused the whole blood grenades, as everyone likes to call them. Um, yeah, but that came out after a week, and I was sent home. I didn't have to be laying in bed 24/7, and basically that sucked. Yeah, I look like I have a black eye just because of totally of the glare. Just saying, I don't have a black eye. No one actually punched me. But yeah, my nipple grafts looks pretty fine. I'm not gonna get too close just because it's kind of nasty still, in my opinion, because it's still, a lot of it still kind of fall off, the little scars on the top of it, and so it hasn't completely healed, and there's little pokies or like sutures, dissolvable sutures that are still hanging out there and stuff. So for those who are a little queasy, I'm gonna spare you that. But basically, this is my end result right now. It's pretty legit. It looks a lot more gruesome than it will be soon enough. Um, Sleeping on my back is probably one of the hardest things. Um, that was torture. I don't like sleeping on my back. I love sleeping on my side. I love cuddling up to my pillows and whatever else not. I'm used to having like a mountain of pillows in my bed and just be like in the middle of them. So sleeping on my back's kind of torturous. But one way I've kind of combated that was like putting a pillow behind, and so I'm like sleeping with a pillow and then I'm slanted on it, so it's kind of cheating, but it's not exactly sleeping on your side. Um, so that's my little workaround to that. Um, my movements have been pretty restricted. Like one of the videos I made before where I felt like a freaking T-Rex, but I've kind of been okay about that now. Like I can extend in this direction. I'm not supposed to go over my head still, I think. I have to check all this in my doc, Garramone, and about, well, after I make this video, basically I'm going to call him, and update that kind of stuff. Bandages I've been using on my drains and my nipple grafts. Let me grab them really quick. So I always have issues with tape on my body and just like putting like a gauze on there and tape because it just falls out because I always am moving because I'm so hyper, like a little child. I actually use these because these, like on the sides, it just kind of like, it's like gauze. You can actually put antiseptic and antibiotic creams on there before putting it on, and then you just kind of, it's like a band-aid, but without the pain of a band-aid, like ripping it on and off, which also means it's not as sticky. I've kind of been wearing my binder yesterday just because I've been getting paranoid. But other than that, they stay on pretty good, especially if you let your body dry first before you put them on. Mistake number one. Other than that, try not to overexert yourself after surgery. A lot of this is just me going over the same details again and again. But the whole 5 pound rule, my laptop is 5.6 pounds. So gauge that from there. I kind of don't really follow that. Sometimes I try and overexert myself just because I'm a little antsy stuff, and I'm really hyper, so that really sucks for me. But I've been trying. I've been trying. I've been killing my mom, which again, I don't like doing that to my mom because I feel like I should be more inadequate to do that myself. But that's basically it. If anyone has any questions, just rate in the little comment box down there. Now comment on that. But yeah, pretty happy with it. Haven't taken any painkillers since I've been back. Don't really think the painkillers work, so I've been taking it the whole entire week when I was there in Florida, and really, I don't think I really needed it. To each their own. I'm allergic to a lot of over-the-counter pain meds, but I have a good pain tolerance as it is, so it might be more painful for you. It might not be as painful as me. Um, but, yep. If anyone has any questions.